Hi everyone, and welcome to my persuasive speech on vaccines and its benefits. Getting vaccinated can help and protect children from serious illnesses and complications of vaccine-preventable diseases. Children and adults should get vaccinated yearly to prevent illnesses that can cause amputation of an arm or leg, paralysis of limbs, hearing loss, convulsions, brain damage, and even death. Vaccines can prevent against diseases such as measles, mumps, and whooping cough. Types of vaccinations include hepatitis B vaccines, diphtheria vaccine, tetanus vaccine, acellular pertussis DTaP vaccine, Haemophilus influenza type B vaccine, pneumococcal conjugate vaccine PCV, inactivated poliovirus vaccine IPV, and measles, mumps, and rubella MMR vaccine. Today I'm going to focus on diphtheria. Diphtheria is a serious bacterial infection that affects the mucous membranes of the throat and the nose. It can be spread from one person to another. Causes of diphtheria. Diphtheria is a type of bacteria called Corynebacterium. The condition is typically spread through person-to-person contact or through contact objects that have the bacteria on it, such as a cup or a used tissue. We can also get diphtheria if we happen to be around a person who is infected. Risk factors. Children in the United States and Europe are routinely vaccinated against diphtheria, although diphtheria is common in countries where immunizations are low. Children under age 5 and adults over age 60 are more likely to get diphtheria. People are also at high risk of contracting diphtheria if vaccinations are not up to date. They visit a country that does not provide immunizations, have an immune disorder such as AIDS, or live in an unclean and crowded condition. Signs and symptoms of diphtheria appear within 2 or 5 days of exposure. Some don't experience any symptoms, as some have mild symptoms that are similar to a common cold. Thick gray coating on the throat and tonsils would be visible. Some will have fevers. Some of us will have bluish skin. Some of us will be drooling, and some of us will have uneasiness and or discomfort. Some of us will experience sore throats, chills, swollen glands within our necks, and a loud barking cough. If the infection progresses, difficulty breathing or swallowing can occur, changes in our vision, slurred speech, signs of shock, pale cold skin, sweating, and rapid heart rate. Diagnosis. Doctors will examine to check for swollen lymph nodes. They will also check for gray coating on throat or tonsils. Doctors will also take a sample that's affected and take it and send it to the lab for testing. Treatment. Doctors will inject the patient with antitoxin. Antitoxin is used to counteract a toxin produced by the bacteria. Make sure to tell your doctor if you're allergic to antitoxin before they begin the procedure. Antibiotics will be prescribed, such as erythromycin and penicillin, to help clear the infection. In conclusion, it is important to stay vaccinated so we don't cause harm to others and ourselves. It's a single shot along with vaccines for pertussis and tetanus. The diphtheria shot is a series of 5 shots given to children at ages 2 months, 4 months, 6 months, 15 to 18 months, and then ages 4 to 6 years old. Very rare children will have allergic reactions. but some allergic reactions can result in seizures or hives, but will go away later. Vaccines will only last for 10 years, so children will need to be vaccinated again at age 12. For adults, it is recommended to get the diphtheria and the tetanus booster shot combined. Here is my reference page, and thank you for listening to my persuasive speech.